You are watching the Doctalk show.
Deafness can be corrected by a medical intervention called the cochlear implant surgery. However, to an ordinary Ugandan, this might be a bit too much for their pocket. So I want to find out if there are ways we can prevent deafness in the first place. To start with, how can you prevent yourself from requiring this surgery? Much as it's very good, it might be a bit costly to the average Ugandan. So, Dr. Chris, when you talk about prevention of deafness, what can you tell the ordinary Ugandan?
There are many things or many infections or diseases that happen during and after pregnancy, and these can be caught and treated, and maybe the mothers be given the right drugs during that time.
Okay.
So
if we can treat those infections in the antenatal, you might prevent deafness in the baby.
Yeah, and think of screening for some that we are not screening for. But good antenatal care may help prevent that kind of congenital or children born deaf. So still in that age, immunization, this is a basic thing, and the government immunizes everyone. Some people may not want to attend immunization.
And yet it's a free of charge service.
Free of charge service.
And some of the diseases which are immunized against can actually cause the deafness.
Yes, but there are a few centers like KCCA Hospital in Chisenyi. They have all the screening gadgets for children, and recently that NGO that works with KCCA did a study with Makerere University in Kawempe Hospital, so we know the burden is there. So it was a huge burden in special baby care unit. So I would suggest those who live around Kampala and cannot afford the private services, because there are few private services that do screen for babies hearing.
How about preventing deafness in adults? The people who are born with normal hearing, but later in life something happens and they become deaf. Dr. Sean, how can we prevent, let's say, regular adults from becoming deaf?
Well, as we talked about, it's identification and prevention, and then intervention, right? The appropriate intervention, whether it's a hearing aid, whether it's a cochlear implant, all those things are important. I want to amplify what Chris said, which is if you're a parent and your child's not babbling by 6 months or speaking a word, increasing by 1 word a month at a year, take your child into a local ENT doctor and get their hearing checked. If you're an adult who notices your hearing is in decline, go get your hearing checked. Find your local ear, nose, and throat or your audiologist and get your hearing checked. Preventing, we'd like to vaccinate against diseases that we know cause hearing loss. Meningitis, crucial. We'd like to prevent noise exposure. So if you're a construction worker, work at the airport, you're around loud noise, over time, that loud noise can damage your hearing. So by all means, wear protection, wear earmuffs, protect your ears. This is a problem that is not acute in onset typically. It's a slow progression, so we want you to save your hearing.
Okay, so people should be cautious about the amount of sound they put in their earphones.
Absolutely, it's probably the single biggest thing we can do to prevent our hearing accelerating beyond the rate at which it will by nature.
If let's say, for a normal person who has not been exposed to much hearing, too much sound, at what age do they start to lose their hearing ability?
Yeah, it's a great question. So everybody's different. Our genetic code is different. Dr. Rollins is different than mine, is different than Chris, is yours. And we're programmed to lose our hearing at a certain age. So some people start to lose their hearing in their 40s, others their 50s, others not till they're 80. So that's why understanding your body and listening to your body, and if you're having a hearing loss, get it checked, because we can implement a treatment. A hearing aid, a cochlear implant, all those are available to patients. So there is no one answer to that.
Okay. So finally, it would be more at a national level, because now we're talking interventions that people can do at their homes. But these programs tend to be very complex, involving multiple layers of disciplines or authorities being involved. So coming from a government angle, perhaps Professor Roland, you want to tell us how has the U.S. implemented that deafness treatment program? Yes. And what advice can you give probably for the authorities here on how to implement this surgery treatment program?
So in the United States, we kind of have 3 layers of insurance coverage or health care coverage. If a person is below a certain income level, or their family is, in almost all health care is provided free of charge as a public process. And if you're above a certain age, if you're 65 or older, then you qualify what's called Medicare. And they also have a special insurance. It's a government insurance, government money, that also provides that level of care. And then in between, the poverty level and the older people is private insurance or health insurance plans. They come in all different forms in the United States. But in general, the public assistance, the private insurance plans, and Medicare all cover the cost of cochlear implantation and many of the things we've been talking about today. I'm very encouraged by the government, what the government has come out with in Uganda very recently, and it was after a World Health Organization proclamation and a Hearing Health Day. And actually one of your very own Ugandan patients who has cochlear implants on both ears, who speaks beautifully, was invited to Geneva and spoke in front of the World Health Organization as kind of the poster child of what a cochlear implant can do. And so we were very excited about that. But your government recently issued a solicitation for projects, for ideas, for concepts for how to both recognize and then manage hearing loss. One of the biggest things that our country does is every child that's born, whether in a public hospital or a private hospital, gets early infant screening. They are screened for hearing loss before they go home. So we're beginning to start that process right here at TMR, where we would like to get the appropriate equipment and be able to screen every baby. We're hoping that would then catch on at other hospitals, so that sooner or later by screening, then you catch the child that needs intervention early and you can do earlier intervention and better outcomes.
So at a policy level, you would advocate that every child who is born must have a screening.
If that's possible
screening for
and
hearing
economically
loss.
feasible and it's not very expensive, it just takes a little bit of manpower, it'd be very good to have every child screened at birth to catch the early ones. And then have more and more hearing testing centers and hearing rehabilitation centers with the capacity to use hearing aids, or eventually refer on to a cochlear implant if hearing aids are no longer working. It'd be very nice to see this country evolve to have an insurance scheme that provides hearing health care, and I think you're heading in that direction.
Yes, yes. I think hopefully the current national insurance scheme will cover for some of these high-tech services, so that it can reduce the burden on people's pockets, so that a child or someone who has a problem of hearing may be able to hear with a subsidized, affordable surgery available to them. So what would be your take-home message for the people? So we'll start with you, Dr. Chris. Regarding deafness, what would be a take-home message?
Okay, I'll stick to the kids still. The mothers should go for antenatal.
So antenatal.
And immunization to kill that battle.
Okay.
Sean?
Dr. Sean?
I would say that this is really fantastic technology. It can change lives. Let's identify the children that are at risk, the children that have hearing loss. Let's do a better job finding them earlier. And let's bring this wonderful technology to them.
Okay, and restore their hearing and improve their quality of life.
Absolutely.
Okay. Dr. Roland, any last words?
No, I think we're in a good place. You know, having come here for more than 15 years, I think we're at the point where we're building capacity. We have clinicians in all the disciplines that are aware and are able to do things and to help. Even ear disease like chronically infected ears can lead to hearing loss, and we're treating that here better than we ever did, and discovering diseases that might lead to deafness. And then once we have built the capacity through education and training, it's acquiring the means to provide that as well, the equipment and the technologies that will help more and more people achieve what they can achieve in life.
Okay. So you've heard it from the experts in the field of ENT surgery, that is ear, nose, and throat surgeries. These are specialized doctors that help to correct conditions that affect the ear. And in today's program, we want to thank the team of visiting surgeons from the USA, Dr. Roland, Dr. Sean, who have told us more about the cochlear implant surgery, and of course Dr. Chris, our very own ENT surgeon, for taking us through the discussion on deafness. If you have any questions regarding deafness, or if you have a child whom you think might require cochlear implant surgery, you can always reach us and we'll link you up to these doctors. Reach us on our social media platforms on Facebook, on Twitter, and we'll always be happy to assist you. Remember, deafness is real. Always take care of your ears. If your child, if you're expecting, go to antenatal and have your child screened. Do not listen to loud music. Always wear protection on your ears if you work in a very noisy environment. And together we can kick deafness out of Uganda. So we'll see you next time on the Doctalk Show.